Why is palpation important? If you're a patient, palpation is important because you first off want to figure out exactly what structure we're talking about. People have pain or they have an injury and they may not specifically be able to point it out. So by palpating and knowing the various insertions and origins of muscles or ligaments or the tendons and where the tendons course through, by palpating we can determine, is it a more superficial structure, something closer to the surface? Is it a little deeper? Is it this specific muscle or that specific muscle? And when we're talking about the difference between this muscle or that muscle, where they originate or may run to can be just very small distances apart. But then, the subscapularis is here versus the deltoid or the pec major here, or the biceps tendon. So as a patient, you really want your therapist or your doctor to palpate and really discern, where is my problem? Of course, there's the whole problem of referred pain. I've talked about this before in other videos, that pain can be referred, or pain is a liar. Pain doesn't always tell you what's going on. Where you sense the pain and where the pain originates are not always the same place. There's an overlap in the spinal cord where the nerves come in from different places, and the information can skip from one group of nerves to the other. The nerves all want to share their information. And that's what referred pain is that it comes in from deeper structures. So, for example, a lung, or the classic is a heart attack. Somebody's having a problem with their heart, and they actually get either jaw pain, shoulder pain, arm pain, and that's because that nerve's coming in from the heart, comes into the spinal cord, jumps over to the other nerves from the arm, everywhere from the elbow up to the jaw, and then that information is conveyed to the brain that's coming from those structures, when in fact it's actually coming from the heart. But again, if you're having chest pain, you have to palpate. Can you recreate the chest pain by palpating those ribs, those joints, the muscles in between the ribs, even to the side in the axilla, in the armpit, the serratus anterior is there. So it is really important for you to discern, where is the pain truly coming from. Say you think you're having a heart attack, definitely it's worth you palpating and pushing and going, oh yeah, that pain in my chest, I can push right there, and there it is. Then that would tell you it's not particularly a heart attack, it's just chest wall pain that, of course, most of us think, oh my gosh, worst thing ever. So palpation is very important. And, I've had therapists out there when I've been in classes, and the question is always, whether I'm giving the class or whether I take the class from somebody else, the question comes up as to, young clinicians or less experienced clinicians will say, how do I get people to listen to what I have to say? Why would people believe me? And speaking to that is that if you can give them more information than anyone else can, you can tell them things that other people can't, that's why they're going to listen to you. For example, one example was in a class, there was a guy who was treating people in the Cirque du Soleil world, and he said, well, how do I get somebody with a different skill set? Some of these people are highly specialized skills. They know more about this skill than anybody in the world. They're not going to listen to me because I don't have that skill. And, unfortunately, the question wasn't very well answered in the class, that the answer really is, if you can palpate, and if you can tell the patient something more about their problem than they know, or you can tell them something about it that they didn't tell you, but you know about it, they're going to listen to you because you obviously know something. Now, that really takes a lot of understanding of anatomy, physiology, how the anatomy works, where the anatomy courses, but also what is pathology? How does that tissue break down? How's that tissue grown? Understanding that shoulder pain here can actually come from the diaphragm way down there, because the diaphragm comes from C3, 4, and 5. And so the shawl effect, as it's known, that people can have pain here, and it actually be coming from their diaphragm or some structure touching their diaphragm. So again, that understanding where things come from, so embryology, pathology, anatomy, physiology, understanding those things, and using your palpatory skills. If you're not getting palpated as to, hey, let's look at this and let's really discern, is this truly a biceps tendon, or is it right next to that at the subscapularis tendon insertion? The difference is very slim, and it's very important to know that difference. You don't want to be getting injections or not getting the right treatment because you didn't have someone really truly palpate and figure out where the problem is. Okay, so let's see how that. If you have any questions, please throw those into the comments. I'd love to hear them, and let's see how that goes.